It's great to have everyone. If you would do me a favor and say hello, just stick something in the chat down below where you're at. If you're on Facebook, if you're on YouTube, let me know you're here so I can say hi to you. It's always great and makes it more fun to do. And I want you to know that I want to answer questions for you today if I can, so you feel more empowered and you feel like you have a direction to go instead of worrying about it and having anxiety about your back pain. So I want to do that for you, so please give me the opportunity to do that for you by letting me know if you're part of this today. So that being said, I want to welcome everybody that's new. If you're new to our family, welcome. It's great to have you here. And if you're a returning person, it's always great to have you back. I hope I add some value to your life today. That is definitely my goal, is to make you feel more comfortable and confident that you can have a life that you have been dreaming about and deserve to have without back pain or with a dramatic reduction in back pain. So say hi, ask me questions. It'll be a lot more fun to do it that way, and let's get at it. So let's talk about this. So today's class, for a few minutes, is how to eliminate your spinal pain and do that from the comfort of your home with a 90% success rate. Where did I come up with a 90% success rate? Well, that's what I've had in my office for the last 24 years. Most of the research as well that you're going to see from Dennis McClure and all of the other big doctors, the Mayo Clinic study, Johns Hopkins, Stanford University, a lot of the studies that are out there, they're at 88 to 91% success rate for people who were pre-surgical candidates. So that's where that number comes from, if you're wondering. If you don't know who I am and you're joining us for the first time, please say hi so I can know who's here and say hello to you and address you. One of the things that I'd just like to share with you is my expertise. I've been incredibly passionate about what I've done for the last 24 years of my life. And hey, Stephanie, great to have you on. Thanks for saying hi. I've had the honor of being on the cover of Chiropractic Economics, Today's Chiropractic, and Spinal Care Today. Those are the three largest chiropractic magazines in our whole profession. And in 2019, 2021, I was also voted one of the best spinal decompression doctors in the entire United States. So I know a little bit about this stuff for you. But I honestly think kind of what maybe perhaps qualifies me is some of the cool people I've got to work with, as it actually does, and it's the next picture I'm going to show you. But I've been able to work with Jeff Foxworthy, Regis Philbin, if you remember him from the Kelly and Regis show, Ed McMahon, Dr. Wayne Dyer, unbelievable human being, Sean Mullen, Suzanne Summers, the Indigo Girls. Those are just a few people that I've had the opportunity to work with over the years. But I hope this picture doesn't gross you out, but I think it's important for you to see. So this was me, unfortunately. This was my back, my low back, after a fall about 3-4 years ago at the skateboard park, trying to inspire my boys to go for something in their life. As you can tell, it didn't work out so well for me, but if you're not willing to fail, we're not going to succeed in life ever. So, but that was me after a week, and typically the only people I've ever seen that were black and blue like that in their spine had fractured their spine. I'm not sure. I think God was looking out for me that day. I never fractured, but I'll tell you what, I was in a lot of pain, and that pain lasted me for a couple months, and I had to pull out all the tricks and everything that I'd ever known to heal my back, and I teach that to you, and I'm going to share some of that stuff with you today. So I've been there with you, so you're not alone. I'm a doctor who injured his spine and had to get it to be healthy again without just doing injections and surgery. So I hope that qualifies me a little bit, and I hope you feel like I can understand your pain as well. So let's talk about back pain. What causes back pain? Well, there's two major things that cause back pain. Number one is the spinal disc. The majority of spinal pain is coming from the spinal disc, and number two is coming from the facet joint. So let's go take a look at those. If you've been with me before, you probably have maybe seen this picture. So this is the spinal disc right here. If you've had a bulging disc or a herniated disc, you're probably a little bit more familiar with it. The disc is made up of two parts. It has this inner part right here, this jelly. It's called the nucleus pulposus. This is the stuff that usually herniates and squirts out, which we don't want. The other part is actually this area right here. It's called the annulus fibrosus. It's the outer rings or belts. It's almost like belts on a like a weightlifter, for instance, who's trying to keep a lot of compression into his spine, except there's layers and layers and layers of belts. So it's imagine like you trying to hold your pants up, and instead of just wearing one belt, you have like 15 belts on. that's the exact same thing that happens. So why does a disc, if it's injured, why can it cause pain? Well, let me show you this picture. It might make it a little bit clearer. So what we're looking at is we're looking down onto a picture. This is the purple area is the jelly part right here. And this jelly has gone all the way through. It's come outside of the disc right here, which is called a herniation, without getting too technical about it. And there's two reasons that you get back pain from an injured disc. Number one is when these annular fibers tear, like we talked about, okay, it's just like you getting a cut. Now there's irritation of tissues, there's oozing that takes place. Well, when the annular fibers ooze, they release things called cytokines, and these cytokines stimulate and irritate these yellow nerve endings called nociceptors. And what these are is all these nociceptors are pain receptors that go all the way around the outer 1/3 of your disc. Hi, Marisa, nice to have you here. So that's usually one of the biggest causes, and you're going to see that a lot in disc bulges as well. So we don't want that. And the second part that's going to irritate the nerves is when there's a blob of nuclear material or jelly that's physically putting pressure either on, again, these nociceptors, these yellow receptors, or the physical nerve fiber itself. So that's what's going to cause back pain for most people if it's disc related. And usually you can tell if it's disc related pain because people have a harder time bending over to touch their toes if the disc is irritated. So what's the number 2 cause of back pain? Well, the number 2 cause is this right here, and it is what's called the facet joint. And so the facet joint is this structure right here, and it's made up of one part of the joint and the other, and you can see this gap right here. Well, that gap is supposed to be nice and smooth, and it's not supposed to be jammed into itself. And so if it gets jammed into itself, it's going to irritate these nerves that go around, and it's going to cause you back pain. And typically, most people are going to feel as if they go to do a back bend because of the facet joints are in the back of the spine. So if you go to a doctor or an orthopedic surgeon or pain management specialist, typically what they're going to do is they're going to do an injection into what's called the medial nerve branch, and they're going to numb that medial nerve branch so you can't feel the disease process that's going on in the inflammation. So, you know, not bad short-term approach to it, but if you want to get healthy, you got to do something to start to get rid of this compression that's occurring, and I'm going to show you the best tool to do that. So I always tell people, you know, it's like you know, if you live up north and you're driving on a road, lots of potholes. You know, they can either patch the pothole up or actually repave the road. And if you want to feel great again and you want to get the life back that you've been dreaming about having, you got to repair it. You really do. Because if you don't, you look at most people that have spine surgeries. Once you start one, you're going to be getting another one, and there's a very high success rate of that. Well, there's a very high rate of that, not success, for people who are doing this. Tiger Woods is a perfect example. You know, started on 1 back surgery, he's on number 5 right now, and he's still in excruciating pain most of the time. So, and you know, he's not going to just any doctor. So that's the 2 causes, and I'm going to show you how to fix both of them at the same time, which is really cool. So I'd like to give you 2 tips today to help you feel better. Number 1 is start holding your phone up. So most people have a phone, and this is how you should be holding it. And so if you want to see how I do it, so it's like this, put your elbows on your chest like this, and you can hold your phone up, and you can swipe, and you can scroll, and you can text, and you can email, and you can talk to people like this, versus that right there, where you're looking down, which is what most people do. Why is that so bad? Well, it's so bad to do that because it compresses your disc right here. You don't want to compress your disc, because once you start going away from neutral, like you are over in this picture right here, you're putting more than 25% of the weight of your head through your disc, and you're going to massively accelerate the degenerative process and wind up probably with bulging and herniated disc. So if you want to avoid all that, please start to hold your phone up. And if you already know that you have this process happening, please start to hold your phone up like that, and it's going to make you feel a lot better. So that's tip number 1 for you. Tip number 2 is we're going to talk about intradiscal pressure and postures and positions. So let's look at this. So what this chart is showing you how much compression is in the discs in your low back in different postures. So when you go to bed and you're laying on your back, you only have 25 kilograms of pressure on your low back, which is pretty cool. If you go down to your side, it's 75, and if you stand like I'm doing right now, I have 100 kilograms of pressure in my low back. If I were to sit in a chair leaning back like this, it would go up to 140, but that's not what most people do. Most people sit like this, forward on their chair, leaning toward their keyboard and their mouse, nothing to support their low back at all, and you are now up to 185 kilograms of pressure on your low back. So if you want to start feeling better immediately, if you sit, do this, but ideally, usually standing is going to be your best key. And if your back's really irritated, the best posture you can go into is laying on your back with some pillows underneath your knees if you're really acute, okay? That's going to be the recommendation that I give all my patients to do. So get away from leaning forward and sitting in a chair, leaning forward toward your desk, and start going in this other direction. It's going to help you start feeling a lot better, okay? So I hope that helps. So what do you do about it if you really want to start to repair your spine? Well, the best tool that is out there for managing this naturally and that you can actually do from home is called spinal decompression. And spinal decompression does one major thing. It helps re-nourish the disc so the disc can start to heal themselves again. And get you on that picture there so you can see me. So here you have diseased disc tissues. There's compression of the disc, irritation to the nerves. And what spinal decompression does is it creates a vacuum and separates the vertebrae very gently and starts bringing oxygen and nutrition and hydration back into the disc so the disc can start to heal. So you can go to a doctor's office and have this done if you're lucky enough for someone in your community to have this. But if you do that, you're definitely going to want to make sure that they're nationally certified in spinal decompression by at least 2 different universities at a minimum. So you have me to teach you if you don't want to do that, or if you don't have anybody in your community that can do that for you. And I teach you how to do it from home. So I'm going to show you a little bit about that. So what's the benefit of doing spinal decompression? Well, this is what you're trying to do. You're trying to take this nuclear material, start to suck that material back into the disc very gently. Feels great. You should always be able to take a nap when you're doing this therapy, and then get these outer parts of the fibers to start to heal and mend themselves again. And that's the whole purpose of it. And then we want to teach you how to keep it that way, okay? So let me show you a quick research project. This is 219 patients that were all pre-surgical candidates that were going to have surgery on this, and they decided to do spinal decompression on them. This was out of Orthopedic Technology Review in November of 2003, and I'll show you a couple results. 86% of these people improved their mobility after doing spinal decompression. That's a pretty large number. 86% of them had immediate resolution of symptoms. That's incredible. 92% of them had physical exam findings and improvements like improvement of reflexes, muscle strength, sensory, the ability to feel properly as well, which is really important for balance. And 84% of them remained pain-free 90 days after their treatment. That's amazing. You usually won't see that even with injections when you're just patching stuff up. So, and these were all people that were going to have surgery, and none of them had surgery, and those were their improvements, which is, I think, pretty incredible. Even here, Dennis McClure, if you've been with me, you might recognize his name, one of the top neurosurgeons in the United States, said when they did spinal decompression on their patients, we observed some rehydration detected in T2 weighted images. What's that in English? That means that on an MRI, you can start to see the discs getting brighter and whiter in color, because when we see that, we know that the discs are actually healing themselves, which is what you want. Because if you don't get that process to happen, you're going to have degenerative disc disease continue on for your life, and you're going to keep patching it up with drugs and injections and surgeries and fusions, and you're going to go down that road, and it's not a good road to go down on. So we want to help you prevent all that, okay? And the amazing part is he said the torn annular fibers was seen in all patients. Those outer rings we talked about, healed in every patient. It's pretty awesome stuff, so you definitely want to look into it. So let me show you a couple successes here. So here you can get an idea of this gentleman right here had massive herniation, severe low back pain, sciatic pain going down his leg, muscle weakness, diminished lumbar reflexes. After a 12-week program, this was his disc right there. Minimal bulge at this point, no sciatic pain, no low back pain, no muscle weakness, was able to go back and be an active husband and go back to work again. So here's another patient that went through our 12-week program as well. Again, a massive herniation right here. And this is this same gentleman, severe low back pain, sciatic pain, muscle weakness, constipation, couldn't be an active dad. Here you can see him almost fully healed in 12 weeks. No back pain anymore, no sciatica. Here's another gentleman, was told by 4 surgeons that he needed surgery on this herniated disc, which was massive. You can see how big it was. Here he was after our 12-week program, almost fully healed at this point, no back pain, out hiking again in his life right now, no sciatica, never had surgery. Okay, you can do this. Here's one more that I wanted to show you. Again, gentlemen, where you can see no nerve fiber right here that you can see at all. 12 weeks later, he had pain going all the way down his leg. Now you can see this nice big open white nerve on both sides of it. That's how it's supposed to look, okay? And no back pain again, no sciatic pain. So all these people, none of them had surgery. They just followed my 12-week program that I'm going to teach you and show you here in a second that you can do from the comfort of your home. So, but let's talk cost for a second here. So what's it cost if you go down the surgical road? Well, if you get a spinal fusion, you're looking at about $138,000. That's the average cost for spinal fusion, and that number is only going up because I look at all the research of that. So if you go down that road, you're looking at a lot of money. Even if you get a laminectomy where they cut out part of the bone to relieve pressure on the nerve, you're still at $52,000. Again, that's a lot of money. If you came to my office, my care plans were about $9,300 for a 12-week course with me guiding you in physical person. So, you know, still way less than these, way more cost effective. But what I want you to see is that I spent the last year and a half creating an online digital course called DISC University that now, instead of you having to come to my office for 12 weeks, I took all my 12 weeks of knowledge and I created it into a video module course for you. And you can do that for $997. So not even $1,000 bucks. And you can get the same results as if you came to my office. So what do you get? So what do you learn if you go into this? Oh, and let's get you on the right side there. So this is the course that I created. I hope that you'll go take a look at it because it's life-changing. We've helped so many people around the world get out of pain and feel amazing from their homes. So I'll walk you through the course here for a second. Well, obviously, we want to thank you for joining us and being part of our family. I show you some success stories so that you know and you see other people's success like I just shared with you. One of the most important things is I go over my guidelines. So before we do any of the therapies with you, I want you to know, and I want your spouse to know, or your significant other or your family, how to support you so that you heal and they give you the time to do what you're supposed to do. So I take you step by step through that whole lot. So you're going to definitely want to watch that video because that's a life changer for people. What else do you get to learn? Well, after I feel like you're ready for that, we teach you how to do your spinal decompression at home. So, and we send you the piece of equipment, and that's included in that $997. So then how are you supposed to feel after your first therapy session? Well, I explain to you exactly what you should be feeling. Then we teach you how to track your success. We give you PDF sheets on every one of these videos as well. So not only do you have the video and you can watch it as many times as you want and rewind and all that stuff, but I also give you a one-page sheet to summarize everything that's on the video to help you as well if you like to learn that way. I'm going to teach you when do you use ice versus heat. How do you get out of bed properly? I'm going to show you the best way to do that. I'm going to teach you how to have optimal hydration for your disc so your disc can repair themselves. Then we're going to teach you how to feed your disc so that your discs get the optimal nutrition so they can repair themselves and heal as quickly as possible so that your pain can reduce. Obviously, you know a little bit about intradiscal pressure, but if you didn't get to watch this, you get to watch my video on that. Then I teach you how to stretch your neck properly so that your neck feels good for you as well. We also have a course, if your neck is your issue, I have a whole DISC University for the neck, and it's all geared same, very similar, except it's more focused on the neck, obviously. I teach you how to stretch your low back. I'll teach you the best stretches for your low back that you'll ever get. These are ones that I've used for over 20 years. We talk about inversion tables. What do you need to know? If your brother-in-law or your uncle has an inversion table, your neighbor, should you use it? Well, you're going to want to watch that video because I'm going to teach you everything you need to know about it so you make a good decision and you don't go backwards. We're going to talk about failed back surgery syndromes. It's a real thing. Dennis McClure used to talk about it all the time. And he said, you know, if surgery fixed everybody, there would be no failed back surgery syndromes. So I don't want you becoming a victim to that. I also teach you how to read your MRI, and I explain it to you in plain English using models and pictures of people and patients and terminology that you're going to see. So when you see words on your report, you don't feel like you're a hostage to your doctor anymore. You feel empowered. I want you to feel empowered about your health. Then I'll talk to you, how should you feel after your first week, after your second week of your therapy, after your fourth week. I remind you to be patient with your healing, because healing takes on average about 90 days for most people's body. Doesn't matter what you're going through. So I just help remind you to be patient during this process. Then when you're ready, we teach you core level 1 exercises, how to feel after week 8. I teach you core level 2 exercises, what you should feel and expect after 12 weeks. I teach you level 3 core exercises as well. And just for put a smile on your face, we add all of the mess ups that I did over filming all of this, just to bring a smile to your face, because laughter is the best medicine. So we get to show you the behind the scenes of making DISC University. So I hope it brings some joy to your life, and some laughter. I always tell people, if you knew what I knew, and you go watch all those modules, what are some of the benefits that you're going to have in your life? Well, you could have immediate pain relief. You could postpone or never have surgeries that you were getting ready to go have. You could reduce your needs for epidurals and facet injections, and you could get back to quality of life and doing the things that you love to do. But what if you don't do that? Well, you can continue, unfortunately, with debilitating pain in your spine and your neck. You could become a victim of a doctor that is money motivated and wants to do a big surgery on you so he gets a big paycheck, and he's not going to go home and take care of you when you're still in pain or you're worse. Reduce depression in your life, because depression is a real thing when it comes to spinal pain. Your anxiety about the future, hospitalizations, perhaps addictive, very dangerous drugs and medications. So you can prevent all of that a lot of times just by knowing what I know. And how do I share what I know? Well, I share it to you on DISC University. So I want to do something special for you today. I'm giving a discount code for the first 10 people. So if you go to DISC University and you go to the link right here where it says coupon code, you're going to type in that coupon code that I'm going to show you here in a second, and it's going to take $200 off for you. Okay? So I want this to be affordable for you, and I want you to go do this because it can change and save your life. So please don't hesitate. Please go take a look at DISC University. You have an idea of everything you experience. We also send you the piece of equipment. You don't have to do anything except wait for it to come. You have immediate access to DISC University. You can start watching some of the videos and getting educated, sitting with your spouse, preparing yourselves to go through the healing process. Marisa, thank you so much. There's the links to DISC University for the neck and DISC University for the low back. And what you can do right here is you can type in that coupon code RELIEF20, RELIEF20, and that's going to give you 20% off, but there's only 10 of these available, so please take advantage of it. Once the 10 is up, it will be back at $9.97, so please take advantage of it. I hope that I've shared some things with you today that will improve the quality of your life and your health and make you happier and feel better immediately. And also, I hope I've inspired you to realize that in 3 months from now, you could be a totally different human being than you're feeling right now. You can start doing stuff that you love to do and stop being scared of what your future is going to be like. So if this is for you, please go take a look at it. Take advantage of the discount that I gave you. If it's for someone else or you love them, please share this with them so that they can feel hopeful and realize that, wow, there is another possibility for getting their back to be healed besides living on drugs, getting injections, and doing surgeries. So I love and appreciate you. Thank you so much for being here today. If you have questions, please DM me. I'll be happy to answer those for you. I go live every week to answer your questions for you as well so that I can speed the process up for you and get you feeling better faster and hold your hand in the process if you need that too. All right. See you next week. Thanks for joining us.